Thank you. Can you hear all right at the back? Brilliant, excellent. So good morning, everybody. My name's Emily Pearson. I'm the Managing Director and Founder at Our Minds Work. And you will see I have a lovely array of plants here with me this morning. They weren't set up ready by people power. I actually brought these in the car this morning, all strapped in with their own little seat belts. And I'm going to be telling you a little bit about how plants taught me quite a lot about understanding ecosystems and how we help things to thrive. So let's continue. Just a little bit about who we actually are. We are a team of workplace mental health experts. We have decades, I feel so old saying that, sorry Emma, I've just probably told everybody how old you are now. We have decades of working in the health and social care sector from very diverse settings, from young people all the way through to adults, mental health all the way through to prison services and homelessness, drugs and alcohol. We've been around a bit. So what we've learned in all of that time is what we can bring into the workplace is a little bit of a different perspective on how we actually create culture change. Culture is very important when you're working in these settings. And the first time I ever realised that we needed specific cultures for organisations to function properly when I was working in a secure centre for children and young people. So I'll tell you a little bit about some of these things that I've learned and how we're actually using it to create these evidence-based models for culture change in the workplace. So our models and programmes are targeted at everybody. When it comes to mental health in the workplace, it is everyone's responsibility. So we target everyone from CEO to frontline staff, and we have a range of programmes to help to solve some of the problems and challenges related to that. But our vision's really simple. We want to help organisations to create mentally healthy workplaces that thrive. I think we all deserve to be able to go to work and be working in a culture where we're able to do that and be our best. So why are we here, or even why are you here today? I know why I'm here, but it'd be nice to know a little bit about why you're here as well. One of the things that we have seen over the past couple of years is we've continued to see an increase in reported poor mental health from the workplace, even though we've seen a massive increase in interventions. Has anyone in their workplace put an intervention in place around mental health? Anyone seen an intervention be put in place, like mental health first aid, work-related stress? Yeah. So we know that 6 years ago, we wouldn't be stood here having this conversation because there was no such thing as workplace mental health 6 years ago. So in those past 6 years, we've been doing a lot to try and raise awareness. But despite this increase, we haven't started to see a decrease in work-related stress, anxiety and depression, or poor mental health in the workplace. So it leads us to start to think, well, what are we doing that's not working? What do we need to do that needs to be something different? Obviously, employers have a legal obligation to protect the health and safety and well-being of their employees and prevent work-related stress and support people with mental health disabilities with reasonable adjustments. But also the employee deserves to be looked after. Yeah, just like these plants deserve to be cared for and to help them to thrive, or else what's the point in having them there? Yeah. So there are employee needs that we also need to be aware of, and it isn't all just about mental health. And I do feel like sometimes we use this term mental health and it means something very specific to a lot of people. But when we talk about mental health, we're talking about it in a much broader sense. Everything that actually really makes us a human being. Everything from the clothes you decided to wear this morning, that would have been decided on the mood you were potentially in, how you were feeling in that moment, where you were going, and all of these things are led by what's in here. So we want to provide you with a little bit of a new way of looking at culture change in the workplace. And there are lots of benefits to this. So when we're talking about mental health and culture change, culture is about our behaviours, the way we communicate with each other, our traditions, the way we do things in an organisation. So when I used to work in a secure children's home, obviously these were children who were at risk of significant harm from themselves or potentially to others. So they needed to be kept safe, or they needed to be secured to keep other people safe as well. Now you can imagine in this environment, when you have children under the age of 18 in a secure environment where they're unable to go out and they are cared for by people who are walking around locking doors everywhere they go. You can start to begin to understand that culture becomes very important in these scenarios if we want to get the best out of those young people to help them to get back into real life and back into the communities. So when we start to look at culture in a workplace organisation, it becomes very important that we understand why we need to do that. Why do we need a mentally healthy workplace culture where people can thrive? Because not only does it have amazing benefits for employees, it has amazing benefits for a business as well. So one of the benefits is about prevention. Yeah, work-related stress is now the #1 reason for sickness absence from work. That's work causing psychological injuries. Does that sound great? Doesn't, does it? Yeah, work shouldn't be causing people psychological injuries. You know, work shouldn't be causing ill health in people, and we do a lot around occupational health to tackle that and prevent it when it comes to physical health, but we seem to still have this problem when it comes to mental health. So prevention, super duper important, and early intervention. The quicker that we can support somebody to look after their mental health and get into a type of recovery and be provided with support, the quicker that person can recover, be able to continue in their lives and thriving in the workplace with adjustments. So we can also create a suicide-safer workplace, and if you're still around later on this afternoon, one of my colleagues, Emma, will actually be talking you through how we actually save lives at work by using a traffic light system. We've just used this with one of our recent clients, a digital marketing and sales company, and they've embedded our mental health continuum model tool into their managers' one-to-ones. So every time the managers have one-to-ones with their colleagues, they will do a mental health check-in using our traffic light system. Obviously, green is mentally well, this is me on a good day, and red is somebody experiencing a psychological crisis and potentially thinking of suicide. In one of the check-ins a couple of weeks ago, a colleague said that they were in the red, said they were having thoughts of suicide, and they were able to then follow a safeguarding policy and procedure we'd help them to implement and to keep that person safe, potentially saving their life. So we can create these suicide-safer communities in our workplace as well. Obviously, it reduces stigma. We need to tackle that as much as possible so that people feel more open and able to disclose. Creating psychological safety in a workplace is really important, that if we're raising awareness, people also then need to feel safe to be able to disclose those things. And it increases mental health literacy for people as well, so we're able to better understand ourselves as human beings and what does it mean to respond to things that are happening in our lives that may be traumatic for us, that might actually begin to cause and trigger poor mental health for us. This actually starts to begin to create behaviour change. Behaviour change is how we get the culture change. The way we behave and communicate is what will drive our culture. So if everybody's working to a programme that is aimed at this behaviour change and creating a mentally healthy culture, the impacts for the business are huge. Not only do they have a financial return on investment, who doesn't want to work somewhere that's a great place to work every day? Who doesn't want to work in a particular industry or workplace where you're excited to go, you feel empowered in the work that you do, and you're able to do it really, really well with the support that you need? And as a business owner, happy people to me means a happy business. So then, what's with the plans? So one of the things that I ended up with a bit of an addiction over lockdown with plants. Anyone else end up with an addiction over lockdown? No judgments on what that addiction might be. It was a difficult period in everyone's life. So for me, it was plants. Spent a lot of time in the house, obviously on my own. So my husband works away a lot, and I found that I needed something else to care for. No children at home, a couple of cats. I'm starting to sound a bit like a crazy cat lady with plants now, aren't I? I'm not, honestly. So what I found with these plants were, these plants that you can actually see here are all tropical plants. You can't grow these outside in the northeast of England. And these plants need specific care and treatment for them to be able to thrive. Now, as you can imagine, when you first start, oh, plants, this is a great idea. They look so beautiful. I need all of these plants. And you're in the shop, you're buying all these plants. Guess how many I killed before? Yeah, let's not go down that road. But, you know, this is the thing. Nobody goes into work understanding how to be an amazing manager. Anyone in here an amazing manager? So we have to learn, we have to learn about how to look after things and how to create an ecosystem that can thrive. So my house now is a bit like a jungle with humidifiers and grow lights and all sorts going on to look after these plants to help them to thrive. One of the interesting things about all these plants on the stage, though, is they're all the same species. They're all called calatheas. They're very, very beautiful. They're called peacock plants. As you can see, they're amazing. They're definitely worth showing off. But just like humans, we're all the same species, but we all look very different. Yeah. We all come with different levels of care and attention that we need. All of these plants, even though they're the same species, are very unique. This one's pretty sassy, the velvet plant. She particularly doesn't like a lot of darkness. She prefers quite bright light, which is quite unique for a calathea because they tend to quite like dark, shady areas. But we can't always fit into boxes, and we don't all come with labels that tell us that this is exactly, if you do this, that's going to work for everybody or for every plant. So what I realized very, very quickly is when we are looking after our teams, our departments and our businesses, we've got to understand them the way that we would understand any type of ecosystem. This is Eden, the Eden Project. Anyone been? No? Definitely on my tick box to go to, so I'll definitely be going there. So when we look at, this amazing project, when they're trying to create this ecosystem, who do you think they recruit to get that jungle to thrive in Cornwall? People who maybe know what they're doing? Not people who are going to go in and start killing all the plants. Yeah, we need particular skills and tools and communication to be able to actually work with what we're trying to help to thrive in our ecosystem. So for us, mental health and well-being is the big umbrella. Yeah, our biggest goal is helping things to thrive, whether it's plants or people in the workplace. So each part of an ecosystem has its own role. So the particular water that the plants are given, how much light they have, the access to nutrients that they have, they all have particular roles to play in how we help the plants to thrive. So it's exactly the same in your workplace ecosystem. If you think about a team who you work particularly close with, you may rely on that team for your team to thrive or not, and your manager as well, and what else is going on in the organisation. So they all interact in their own special way, and they all play the bigger part in working together, which they don't generally know about when it comes to ecosystems and plants, to help something to thrive. So what we've done at Our Minds Work is working in health and social care. We've used this social ecological model for prevention and behaviour change. It's used a lot in public health. And we can actually attach this to any topic, but what we've done is we've brought it into the workplace to help businesses to better understand how to build a strategy for creating culture change with mental health at its foundation. Obviously, we start off with the individual in the middle and we get outside into policy. When we're working with an individual, we can only generally change what that individual is potentially experiencing. So if you think of some of your initiatives that you've maybe put in place, anyone delivered mental health awareness in the workplace? A lot of people. You probably only kind of reach the level of the individual and maybe raised their literacy levels rather than created behaviour change. Anyone implemented a well-being and mental health policy and strategy in the workplace? Couple of people there. So your policy is for everyone. Yeah, that's how you make the decisions. This becomes part of your culture. This is the way that we work. This is the support that we're going to provide. This is how we're going to create that change and support people if they're struggling. So the further out from the centre we go, the more we can actually have an impact on behaviour change and culture change. So as you can see here, I'm just going to give you a high level of this because I don't want to go too much detail into it. What I really want to show you is how we've translated this into a framework that also works together with the Thriving at Work standards, And it also works with the Health and Safety Executive Management Standards as well. So we've brought all of these 3 theories and standards of best practice together to actually create behaviour change. But just to show you that you can actually use this model for any topic. So anyone been covering menopause at work lately? That's been quite a topic. A couple of people with their hands up there. We can use this exact same model for menopause. Yeah, if you've got a wellbeing policy, what are we saying that we're going to do to help people who are experiencing the symptoms of menopause? How are we going to support the individuals? Within our organisation, what behaviours or social norms do we need to create? Do managers need to be more educated on how to support people and the impacts that it can have? So this model you can actually use for any topic. We're just using it to create culture change in the workplace around mental health. So what we're going to do is we're going to use the model, which is available for you to come along to a free half-an-hour consultation at any point during the day. We're over in a corner. You'll see the plants. That's where we're at. Come over, have a free consultation. If you don't have time today, then come and find one of the team over here. So this is Emma and Kirsty, and you can book directly into my diary for a later date. And what we'll do is we'll do a free consultation. We'll benchmark you against the model to see where your strategy currently is, what you're doing well, and where are the room for improvements. So obviously, to create an ecosystem that thrives, we need a model to help us to get there. So this is our model where we're able to evaluate. When we evaluate something, we better understand where we are, what are the problems we're trying to solve, what are the challenges we need to look at. C is for collaborate, working together. We have to be able to work together in the workplace for culture change, especially within your teams. Each of your managers in the workplace create their own cultures. Every manager that comes into a workplace has their own way of doing things, their own way of communicating, their own behaviours. And what can happen is this culture then is created by default rather than by design. What we want to do is create a culture by design where all managers know and have the skills, tools and behaviours to create mentally healthy teams. And then ownership. We all have to have ownership of either looking after our own mental health and taking action for recovery, or for making sure that we're supporting other people, or as a business owner, making sure that we have our duty of care for our staff and we're providing that prevention and protection for them. So using this model, we will be able to help you to start to create your strategy. And this strategy is based on, let me just share a different screen. This is our culture change progression model. So using a traffic light system, you can see here, the business impacts are at the top there, which I've talked through a few of them already. And our model starts really on the outside. Instead of the circles, we've got squares here. It really starts on the outside and works our way in towards the individual. So how to get senior buy-in and leadership and sponsorship, understanding what treatments and therapies people may need to be provided with, and making sure that they're actually really well promoted. Your strategy and your policies that override well-being in the workplace and what that means to each individual. The management and prevention of work-related stress. HSE legislation, this is a legal obligation to do stress risk assessments. A lot of companies are not doing these and are actually currently not legally compliant. HSE just released the other day that they're actually going to start asking people in the workplace when they're doing the spot checks if they are doing stress risk assessments. So they are going to start kind of clamping down on this a little bit if you're not. Managers, what training do our managers have to actually change their behaviours, implement tools, be able to support their teams? Anyone got mental health first aiders in the workplace? Wow, loads of hands. This is quite an interesting one that I'll just maybe talk through a little bit. What we have when it comes to mental health first aid style initiatives, because there's lots of different ones that you can implement, that not implementing that initiative at all is safer than doing it wrong. And we see a lot of companies come to us. We've got 60 mental health first aiders. They've had 2-day training and then we just went, see ya. We'll maybe meet up once every couple of months, but when nobody's monitoring them, they're not given additional support. There's no safeguarding policy and procedures for people to follow if someone's at risk of suicide. It starts to create more risks than what we're trying to solve in the first place. So that's always an interesting one. But this again is, the support that you're providing internally. And then we've got employees, so that's your individual, what are we doing to support them? And obviously monitoring and embedding it. So using our traffic light system, obviously nobody wants to be at risk. Yeah, that's a really toxic workplace culture. This is where the plants are all dead. Nobody's looking after them plants. What we want, and a lot of our clients work towards, is mentally healthy. Some of our clients want to go above and beyond that and get into inspiring culture. So this is how we've brought the social ecological model and the Thriving at Work standards together to actually implement this culture changing strategy in the workplace. Slide that back over again, because I think we need time for questions, don't we? Is that right? Okay, cool, brilliant. So I just want to summarize this a little bit for you. It is a lot to take in, and is anyone in this room responsible for their mental health strategy or improving people's mental health and well-being? A couple of people. Do you feel like you have the right knowledge, tools and qualifications to actually do what you've been given the responsibility to do? Okay, yeah. And we find this a lot. What we've seen with mental health, especially in well-being, it's been kind of shoehorned into an HR role, and a lot of people are given this responsibility to do all of this stuff, yeah, without the knowledge, skills and tools and even qualifications to do that. And what we find is we get a lot of HR people coming to us and saying, I just don't know what to do. Or they come to us and they've done something that's actually created a bigger risk. So just another example, somebody gave us a call in a little bit of a panic. Somebody had told a manager that they were having thoughts of suicide. This manager had then assessed somebody as low risk. I'm not quite sure how you assess somebody's mental health and risk of suicide when you're not a psychiatrist or a medical profession, but they did. And then that person was sent up to work on a roof. It's quite scary, isn't it? Yeah. But it's not her fault. These people only know what they know. Yeah, when it comes to mental health in the workplace, we get that a lot. We're not mental health specialists, and you don't need to be. Yeah, that's why we exist, to help you to take all of that pain and fear away, because it is scary stuff. We're talking about people's lives ultimately at the end of it. So if we want to increase, we don't want to increase poor mental health. We definitely don't want to do that. We want to decrease mental health. We want to decrease poor mental health in the workplace. If we want to do that, it does require this holistic human solution to it. Yeah, it's got to have the people and understanding of the culture that we want to create at the foundation of it. Just doing mental health first aid as a one-off or mental health awareness as a one-off doesn't change behaviour, and it doesn't give you that actual strategy. So taking the perspective of our workplaces through the lens of this social ecological model that I just showed you, we can actually focus on problem solving. Yeah, what's the problems we're trying to solve, and how do we implement initiatives in all of these different layers to create that improvement and culture change? We need to focus on prevention. Yeah, it's a legal obligation. I can't say that enough. When it comes to work-related stress and psychological injuries, you have a legal obligation to prevent that, and it's not happening. Yeah, we have the highest levels of reported work-related stress, anxiety, and depression than we've had over the past 18 years since HSE started recording that data. Yeah, yet we know more about it than we ever have done before. So we have to make sure that we're empowering behaviour change. Yeah, we've done the awareness bit. We've spent 6 years raising awareness, trying to tackle stigma, opening conversations. But what we tend to find is if you haven't done the policy stuff first, the senior leadership buy-in first, the manager stuff first, people might be more aware, but they don't feel able to actually share or disclose for the fear of discrimination from them. So using our ECO model, which is evaluate, collaborate and take ownership, yeah, we can provide a really simple 3-step approach to implementing a really simple strategy for mental health and well-being in the workplace. And if you use our progression model, it aligns with all of these best practices to help you to achieve a mentally healthy workplace that thrives. It's tried and tested, it's evidence-based. We can put menopause onto that. You could even put, we want to tackle smoking, you could tackle smoking through this model. Obviously you would take work-related stress out. Well, actually, would you? Maybe everyone's smoking because they're stressed. You never know. So if we want to have a workplace that is full of beautiful, thriving individuals, a bit like how I want my plants to be, we have to think about culture change. Yeah, mental health is much more than a mental health awareness and some first aiders. We've got to start to create the change in the culture. So, does anyone have any questions? Questions about plants are also okay. So hello, yes.
You've talked a lot about work-related mental health and mental health and wellness in the workplace, but I think in my experience, people's lives aren't so clearly demarcated between work and the rest of their lives. How does your approach work with that?
Yeah, of course. And I mean, the prevention side is the how do we prevent workplace psychological injuries, which is your legal obligation, isn't it? You know, it's really important because as an employer, you are able to take action on that and make those improvements. Whereas if individuals are experiencing poor mental health because of private life stuff, you don't have much control over that. What you can do is provide reasonable adjustments and support for that person to get the help that they need to get through that stuff. Yeah, so this is why I talk about prevention quite a lot, because that's something as a workplace you're legally obliged to do, and it's something that you can actually take action on and create that improvement. Prevention is always better than cure for people, yeah. But I think when it comes to people who are experiencing psychological problems from their private lives, we see the impact in the workplace, don't we? Potentially we'll see a change in maybe it's their mood, maybe it's a change in the behaviour, the performance levels may begin to dip. So then that should really alert us to be saying, you know, you're not your usual self, is everything okay? And be able to start to look at what's the problem, what can we help with? There may be something that we can do in the workplace to support that person. We may be able to signpost them to support that's available. So I'm thinking about financial debt problems cause a lot of stress for people. Yeah, workplaces can provide professionals who are able to support them through debt management. So what can we do to support that person and help them to tackle the problem themselves? But prevention is a legal duty. You are also there to protect their health and well-being and safety in the workplace as well. Thank you. Anyone else have any questions? Oh, that was easy. Anyone want to come touch the plants?
Can I just ask, just obviously when you mentioned the crisis situations, sort of expand a bit more about that, because when I'm working with a lot of clients, that's their worry, that's their fear of not knowing what to do and the training not being enough. So
Yeah.
just on that, if you don't mind, please.
Yeah, of course. So we do get this a lot. We know that a lot of employers have implemented mental health first aid style initiatives. So people have given 2-day training and made responsible for mental health first aid for other people from 2 days of training. Now, as you've seen from our model, there are certain other elements that we should be providing support with, especially around policy. And one of those policies should be around how we safeguard people. Does anyone have a safeguarding policy in their workplace already? Does it cover colleagues at risk of suicide, or is it just about young people or apprentices? Don't know? We know we have a policy, but I don't know what's in it. So another thing, isn't it, to think about, if you do implement these policies, who knows about this stuff? And how we need to be able to make sure that people understand what to do if there is a crisis. Training everybody in suicide intervention isn't actually needed. But what you can do is help managers to use tools and collaborate on tools with their colleagues so that their colleagues are able to evaluate their own mental health. Yeah. So am I green? Am I orange? Am I red? And if I'm in the red, that manager knows this is our safeguarding policy and procedure. This is what I need to do if my colleague is at risk of suicide. Yeah. And then what happens afterwards? Yeah, are we collecting data, making sure that people are supported afterwards, and making sure that if there has been a situation, is there anything we need to do next time to prevent it from happening again? So yeah, policy procedure is really important, but lovely example of how making sure that everybody understands what that policy and procedure is. Safeguarding should be for everybody. If you have somebody in the workplace who's experiencing psychosis, and one of our clients have had this, a colleague that's at work experiencing psychosis, that person has then potentially just become a vulnerable adult that also falls under protection of a safeguarding policy and procedure. Yeah. If somebody's at risk of significant harm to themselves or others, how are we going to safeguard that person? So yeah, policy, procedure, and making sure that people are really, really aware of it, and it's very, very clear in these situations how we do that. Because what we've potentially done is we've opened the door and went, come and talk to our mental health first aiders about your mental health. And then a mental health first aider sat there trying to remember the algae, when actually what they need to be doing is probably thinking about what's our safeguarding policy and procedure, how do I escalate this and keep this person safe? Thanks, Rachel. Any other questions?
What sort of like knowledge and training do you have access to?
I think you've first got to start off, why are we doing this? Yeah, why have you put mental health first aiders, or why do we want to put mental health first aiders in the workplace? Yeah. The title's brilliant, isn't it? Mental health first aid. Who doesn't want to have mental health first aiders? It sounds amazing, but it doesn't quite work like that in practice. That's just the title of a course. And the content of a course becomes very important about what do you want those people to be able to do when they leave there. Yeah. So what's their role? What's their responsibilities? What are the behaviours that you're expecting them to engage in? You know, what are they supposed to do? Now, a lot of people want to use that role, more of a kind of advocacy role, more of people who are an active team together, who are out there raising awareness, you know, sharing their own lived experiences safely, making sure that they're, you know, running campaigns, they're signposting people, you know, left, right and centre, but without actually having to come into face-to-face contact with them. That's your biggest reach, isn't it? Yeah. Waiting for somebody to come over to you as a mental health first aider, it doesn't happen very often. So then those skills and knowledge tend to get kind of, oh, I've forgotten what to do, I'm not quite sure what to do in this situation. So I think it's really important that you are very, very clear on what do we want these people to do. Yeah. If it's just to train them and for people to come along like a physical first aider, if they're having a panic attack, then mental health first aid is for you. Yeah. Because they're basically the skills that it'll give. But then the other element is that how do you also make sure that those people are protected? Yeah. Vicarious trauma. So within a counselling session, within a counselling service, we don't just, you know, oh, somebody's on the phone here, they're experiencing trauma from, I don't know, a bereavement from suicide. Yeah. That person is triaged and then matched with the right person to provide them with those services. And that's for two reasons: to make sure that the individual gets the right care and support and treatment that they need, but also to protect the counsellor. Yeah? If a counsellor has previously gone through death by suicide, this could be very, very triggering for them. With mental health first aiders, we're not doing that. There's no triage. Yeah? So people are going, come and talk to our mental health first aiders about your mental health. And that means come and talk to these people about anything that's causing psychological distress. Anything, yeah? Mental health first aid probably didn't cover that bit. They just covered the signs and symptoms of these things that the person would experience. So it becomes a little bit more kind of complex when we start to think about what's the role and responsibilities, what do we expect them to do, and how do we make sure that they have the right training to do that safely, and we're providing all the support, the policy, the governance, the guidance to help them to carry out that role. Yeah, thank you. Any questions on, I forgot we were on live stream. Hi live stream people, where's the camera? Hey. Nothing on there yet. Okay then. Unless there's any further questions, we will be hanging around here for the next few minutes, collecting all of our plants. If you would like to, grab the opportunity to have that free consultation today and you've got half an hour spare, come and see us over in the far corner. If not, come and grab us and we'll book you into our system, for whenever you're free, and we can get that free consultation and benchmark and exercise booked in for you. But thank you very much, and I hope you enjoy the rest of your day. Thank you.